This is Pet Life Radio. Let's talk pets.
Hello! You're listening to Animal Party on Pet Life Radio, and I have a special treat for you today. First time ever on my show from the Schwarzman Animal Medical Center, Dr. Fox, Dr. Carly Fox. Welcome to the show, Doctor.
Thank you so much. Thank you so much for having me.
Can you tell me, first of all, just to begin the show, what is the Schwarzman Animal Medical Center all about?
Oh, totally. Yeah. So the Schwarzman Animal Medical Center is a very special place. It is one of the largest teaching hospitals in the world, probably for veterinary medicine. We're located in Midtown Manhattan, and we've been here for over 100 years. It's a very well-established hospital. We have almost every veterinary specialty available under one roof, and we see thousands and thousands of patients every day and treat very complicated medical problems for pets.
So you do like hip replacements all the time?
Absolutely, yes.
And eye surgeries? That's expensive.
Yeah.
Is that one? Oh, okay. And I mean,
Totally.
I remember when I first started out in this business, people used to take their animals to the veterinary colleges if they couldn't afford to pay the vet. And they would still have to pay something, but very little. But is that the kind of thing that's offered there? Like, how do patients access the teaching hospital?
So what's great about the AMC, that's what we call it,
Okay.
is that it is a non-for-profit hospital. So we have a lot of funding for patients who qualify for our funding. And it's very variable who qualifies, but it's typically patients that have a fixable problem with an overall good prognosis. So if you have an animal that has a problem that would be fixed with like a surgical intervention or, one-time stay in the hospital, we have a lot of funding for that. So a lot of people do come to us to access those funds. We also treat all of the guide dogs in the tri-state area for free, also, as well as the NYPD and FDNY dogs. So we have we see tons of working dogs, and it's a great program because we also get to know their handlers, and they have very specific types of diseases because they're also large breed dogs, a lot of them, and they have a job to do, and it's very important that we keep them healthy.
Do they have wearing of the pads and issues with where they walk?
Not typically. You would think you would see it more with, especially in New York, since they walk on concrete a lot, but
Yeah, hot pavement.
I know, and it's weird. You'd think we'd see it more, and the pavement typically gets, much hotter than the air. A lot of it has to do with like humidity and direct sunlight, but because there's so many buildings that cast shadows, it's actually sort of less of a problem than you would think, but it is something that sometimes we do see.
Okay. When you talk about this, it makes me wonder about how things have changed. I mean, 100 years, that's a long time. How have things changed over there in all that time? I mean, when I look back at veterinary medicine, even in the course of my time, the medicines have changed so much. There's so many new medicines, and sometimes I'm a little bit skeptical. Like Apoquel came out, and it seems to me that around the same time, a year and a half later, when Apoquel started to be really prescribed in all kinds of cases where it seemed to me they weren't delving into what the animal was allergic to or what the problem was, or they were just Apoqueling it. And now I seem to be finding the flea products aren't working as well. Now, I don't want to be a conspiracy theorist, but the cat products especially, and I'm getting complaints from my listeners, from my customers. I went to the vet and talked about it, brought a cat in, and he said it's a terrible situation this year. The more expensive products you buy from me are no longer working. So are you finding that?
In New York, also, most cats are, to be honest, they are indoor cats.
Yeah.
So really, it's very rare that they are allowed outside. Sometimes in the boroughs, people allow their cats outside. But as a veterinarian, especially in this area, we typically try to steer people towards having their cats inside. But not every medication, but some medications, there can be resistance that develops, especially with older insecticides like Frontline has been around a long time. But I do find that Revolution in cats, which is usually my recommendation, is pretty effective in helping decrease flea and tick load in cats. So a lot of the times also it may have to do with like improper application from the owners, or they bathe their animals around the time of application, inconsistent use. environmental reinfestation, things like that. I think to me, and again, my background is emergency and critical care, so I'm not a general practitioner, so these aren't the cases that I see on a daily basis. But when I do see an animal that has like a overwhelming flea or tick population, I find Revolution to be, especially for cats, one of the best and most effective ones. For dogs, I typically will recommend Simparica Trio because it covers for everything. And if your dog is in a heavily wooded area, I will also recommend a Seresto collar on top of that. And also, I think, I don't know, I guess I'm personally not seeing that as much, but I think a lot of it also has to do with like treating all the pets in the household and a lot of environmental things.
And people are really reluctant to. It's kind of like when you get the letter home from school that some kid in the class has lice. No one wants to believe it, right? You don't want to.
Well, I recently have gotten that letter. So I know.
Oh, no.
I know what that feels like. I know. It was like my heart thing. So it's terrible. But anyway, we're lice free now. So.
But some of the meds have improved a lot. Like when I think back to the itchy, scratchy dogs who couldn't get diagnosed, who would pick themselves raw and go bald, they used to be on prednisone. And that would change their whole personality. And they'd become
1,000%.
These vacuum cleaners. And they would be aggressive about food and they would get fat. And I mean, Apoquel's a huge step up from that. So, okay, well, now that I know that you're an emergency vet, we're going to talk about that when we come back from the break. Stay tuned, everybody, on Animal Party Pet Life Radio.
You know the expression, cats have 9 lives. Well, what if you can give them one more? The Give Them 10 movement is on a mission to help give cats an extra life. How? With spay and neuter. Spaying or neutering your cat helps them live a longer, healthier life. And it helps control free-roaming cat populations too. Learn more about the benefits of spay and neuter and meet Scooter, the neutered cat, at GiveThem10.org. That's GiveThem10.org.
Let's Talk Pets on PetLifeRadio.com.
Hello! We're back from the break, and we're talking to Dr. Carly Fox, Dr. Fox, from the Schwarzman Animal Medical Center. Gotta point out that we're being hosted by a wolf, and my guest is a fox. So that's very apropos. All right, so what's the most common thing you see in animal emerge? Is it bleeding? What is it?
No, I would say it's actually pretty similar to a human emergency room. So what we see most commonly is just like gastrointestinal upset, like vomiting and diarrhea from cats and dogs, inappetence, things like that. But we see absolutely everything here, which is part of my job that I love so much. So we'll see animals that are having difficulty breathing, collapse. We see hit by cars and other traumas, bite wounds, especially with all the dog parks in New York City. We see high rises, which is when most of the time cats, although we do see some dogs fall out of windows because we live in an urban environment, dogs that get hit by bikes on the street, traumas like that. But I'm very used to seeing everything.
Can we circle back to that cat thing? Can we talk about that cat thing? Because it's a real myth out there. And there's lots of footage of cats bawling and righting themselves. And, 10 stories, 12 stories, people say they can do it. And some cats might sometimes. But you're here to tell everybody that isn't always a success, right?
Absolutely not. So cats are special in that they do have a righting reflex, which dogs do not have, and it's unique to cats and other animals that are sort of tree living. So our house cats sort of evolved from outdoor cats that lived in trees, just like large cats do. And because of that, they have this special thing where their body will sort of right themselves in space when they fall, whereas dogs will just fall
flat. Yeah.
Right.
Dogs go flat. Cats turn over. They do this amazing dance in the air where they right themselves, but not always.
That is correct.
Right?
But this is what's interesting. It depends on where they fall, how high they fall from. So we found that typically cats can right themselves up until like the 6th floor. And then after that, their body doesn't understand that they are still falling because they reach what's called a terminal velocity. And their body doesn't get the way in which they fall is basically like their body doesn't understand that they're falling because they're not gaining any more speed. So in that case, they sort of lose their ability to right themselves because their brain doesn't understand that they're in flight, essentially. And because of that, they will sort of turn on their side or turn like lateral. And we'll see different injuries depending on which sort of height they fall from. But I think the takeaway there is that cats fall out of windows quite commonly, especially in urban environments, and they can develop very severe injuries from that require medical attention. And even if they fall from very high stories, they can survive. The prognosis is actually very good for these patients with care, but it just means you must bring your animal in. Even if it looks like they fell from 2 stories versus 12, they have to seek medical care because they can still be very, very injured.
You also mentioned the other common things. Among them was, I believe, car accidents and bite wounds. So in those cases, are people likely to maybe think, oh, he's okay if there's not a lot of blood and not come in? Or how do you know when you need to?
Totally. So, I mean, my recommendation is that you absolutely need to come in no matter what, even just a small bite wound, because bite wounds are sort of like the tip of the iceberg. There could be a lot more damage underneath the bite wound, and there often is. So they often also, dogs' mouths are dirty, so they are very likely to become infected.
Oh, dogs' mouths are dirty, but human mouths are worse, right?
I mean, I think all mouths are dirty.
Okay. I just wanted to say, because some people are like, oh, you let your dogs lick you. Yeah, okay, well, you let your husband lick your face, and I don't know about that.
Totally. I mean, I'd let any dog lick me for sure. But if there is an actual like puncture wound, they need antibiotic therapy. They often need it to be locally addressed with cleaning, prevent massive infection, because sometimes people won't notice, or, you know, dogs are furry, hairy, a lot of them. So the people a lot of the times won't even see a puncture wound until it becomes infected. And then it's a big problem.
Especially around the scruff, right? Because it's usually when the dogs fight, there'll be a bite wound somewhere around the neck, cheek, throat, top of the head, in where they're really furry. So it's hard.
Yeah.
It's hard to, you know, if they went at it and both dogs were sort of in a, my head's taller than yours, no, my head's taller than yours, and then they erupted in a face-to-face fight, that's where the wounds are going to be. If you see a dog running away getting chased, well, he might get bit in the bum or the leg or some other part the chasing dog could reach. So you kind of got to really, really feel around and look and feel for warmth or wetness, because if they're licking the spot, or if it's wet from blood, or if it's warm to the touch, that could be the area you need to maybe do a little scissor clip and see if there's something there, right?
Yeah, that's exactly. And if you can't see it by parting their hair and you think that there's something there, if your dog seems bothered by it, then some sort of like clippers is even better than a scissor, because you really can't injure them. I see a lot of people who try to cut mats off their cats, especially, and they come in with a laceration from the actual scissor. So if you can, even just like on Amazon, a good thing to do is just to have a set of clippers. They're like $30. It's a good thing to have in the house just to have just in case.
Yeah, the thing about mats I find is you got to loosen it first. You can't just cut it out because it's pulling from very far away places in the skin. And when you cut, you're going to cut skin. So you have to actually like take some product like cornstarch or a marketing, you know, a product in the store, but I find cornstarch works, and rub it in really, really, really well and brush that out before you can scissor clip from the ends first, because it will release. Totally. And then you get to, well, I'm just telling my listeners, I know you know. Okay. Okay. So, all right. So that's the bite wound thing. What about the car accident thing? If the dog seems okay, he got hit by a car, he cried, he ran off, he comes home. Is he okay?
Yeah. So that's a big thing. So we talk a lot in emergency critical care about like delayed signs of trauma. So when a dog gets hit by a car, sometimes people are like, well, he ran away, so he must be fine. He was walking right afterwards. But a lot of the times, significant orthopedic injury, neurologic injury, or even internal injury like bleeding into their abdomen or contusions or bruising of their lungs can become more evident over time. So even if your dog looks okay after getting hit by a car, having some sort of blunt trauma, no matter what it is, you absolutely need to have them assessed by a veterinarian.
Okay, so we're going to go to break and come back, and I'm going to ask you why things seem more expensive. Here, it seems like there's a corporate takeover of a lot of my favorite vet clinics. Okay, we're going to go to break and come back and talk about that on Animal Party Pet Life Radio.
Has your dog or cat chewed through yet another set of sheets?
I get it. I've been there. But instead of replacing them with more scratchy, low-quality bedding, why not treat yourself to what Oprah and Kris Jenner sleep on every night? It's called Cozy Earth. And yes, it's as dreamy as it sounds. Their bamboo sheets and pajamas are buttery soft, cooling, moisture-wicking, and they actually get softer every time you wash them. I'm talking next-level snuggle mode here, folks. These sheets have been on Oprah's favorite things list 7 years in a row, and there's a reason why. Cozy Earth gives you the softest, coolest sleep of your life. And just for Pet Life Radio listeners, I scored you an exclusive 41% off. That's the biggest discount they offer anywhere. Just use promo code PetLifeRadio at CozyEarth.com and sleep like the celebrity your pet already thinks you are. That's CozyEarth.com, promo code PetLifeRadio. You'll thank me at bedtime.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Hello, we're back on Animal Party Pet Life Radio, and it seems like prices keep going up and up and up, which makes people not want to take their dog in if he seems okay when they really ought to, or their cat. And I'm wondering, it seems like a lot of the clinics here are no longer owned by the veterinarians, they're owned by a corporation. Is that a problem in the States too? And is that why the prices seem to be climbing?
I don't want to say it's a problem, but it is definitely a trend that we see a lot more of. I think because veterinary medicine is a big business that a lot of private equity firms are interested in it and will invest into roll-ups of hospitals, et cetera. The AMC is, again, a non-for-profit, so we are not owned by anyone. There's a board that controls the hospital, and it's very different than your like general practice around the corner. I work at a very large specialty hospital. So thankfully, because our non-for-profit status and the fact that we're a teaching hospital, we personally don't deal with that, which I think is great for the doctors and also the patients that come in here. However, it is something that we see very commonly in veterinary medicine now, especially. And I think there's many different causes of it. I think just like as we would want, I think veterinary medicine is getting more advanced as far as diagnostically and treatments. And these clinics are becoming much more modern compared to what they were, many years ago. So we have access.
Well, that's part of it. But sometimes, like with some specific things, I really wonder. Like in the old days, and this is a long time ago when I started, I was a vet tech at a clinic where we did emergency care. And we kept 2 or 3 donor dogs. They were like SPCA type dogs who were on borrow. They'd be on borrow. We'd borrow them out for 3 weeks, and then we'd find them homes. And they were always the best, good-natured big dogs. And they'd be there to donate blood because it was our understanding back then, and I think it still is, that when an animal is first injured the first time, the blood match doesn't matter, and they can receive blood from any dog. So if a dog came in needing blood, we had the donor right there, and we'd hook them up, and it was about $100 extra for the customer. Well, now, if your dog needs blood, you got to get like this blood test, you send that out, get it back, then the blood products get ordered and sent to you, and the whole thing's about $1,000. So I don't know that that's necessarily an improvement for a one-time application.
Well, I think there's much more that goes into that than I think what you experienced a couple of, when you were working. So all of the blood here, we do get it from a blood bank. All of that blood is also tested just like a human. And dogs can't just receive, although if they're naive to receiving a transfusion, you don't need to. Blood typing in dogs is different than in blood typing in cats, and dogs that can be either DEA positive or DEA negative. So it actually is important to test them, and it depends on what blood you have. We only carry DEA negative blood. So DEA positive and negative dogs can actually receive DEA negative blood, but you can't give a dog that's DEA negative positive blood.
Possibly that was going on then, and I just didn't know that. Like possibly our dogs were all DEA negative. I don't know.
Right. I think that's another thing is like you would need to know that before having them be in the clinic, or maybe they didn't know and maybe they had complications, secondary to their blood transfusions that maybe they were monitoring for.
No, they probably had tested. This is one of my first jobs, so I'm not really. I don't think I was privy to everything there, but
right.
But it was a really good clinic, so I think they knew what they were doing, and I never saw any adverse situations. But that's just like one thing. A house call for euthanasia used to be $100. Now it's $1,000. I don't think that's due to tech or new inventions, you know?
Oh, well, I think it also just has to do with, I mean, again, I don't do house calls for euthanasias, but I think it has to do with also the cost of body deposition, which has to do with whatever service that they use. And the costs have to be secondary to whatever they're charging, just like everything's getting more expensive.
Yeah, it's true.
So and it's also those people's time and the technician that they hire to come with them and transport of that body after the euthanasia. How about if it's a large breed dog,
True.
et cetera. And also, I think it's a service that is a luxury, having someone come and euthanizing their dog in their home rather than going to a veterinary clinic. So I think, again, I don't do this or I don't know how much people charge for it, but I do think that, those charges are justified. Also, being a veterinarian, it's a tough job. And I think that the people's perception of what we charge for and don't and our cost is usually very off, to be honest with you. Veterinarians graduate with hundreds of thousands of dollars in loans. Veterinarians are not paid a lot of money, especially compared to our human counterparts. We deal with people expecting us to treat their pets for very low cost or no cost when we have major overhead in our hospitals that, we're responsible for. Most clinics are, functioning at very low margins. And I think people need to understand, and there's a huge emotional toll that veterinarians deal with every single day, dealing with people and their pets and feeling responsible a lot of the times for people's poor decision making when it comes to their pets. So I feel like all costs in veterinary medicine are 1000% justified. And no one is trying to rip you off. It's really something that there's a lot of background there. And I think people don't realize that.
I'm glad you said that. And yeah, I think that's important to recognize. I mean, the toll on you when you recommend something and they won't do it.
Yes. And then they blame you.
And then the dog gets sicker or dies, and then it's your fault, and it could have been fixed. Or when, it's something so like grooming and they're just not listening, and, ear mites or whatever, the dog's now deaf. Let's talk about some of that. What bothers you the most when they don't listen to your advice?
For me, again, I'm seeing animals that come in very, very sick. And I think a lot of the times, thankfully, because I work at the AMC, in a lot of cases, I'm able to help them through funding if it's something that I think is treatable within a hospital stay. But if I see an animal that has a chronic disease or a disease that's sort of been neglected by the owners or people who don't seek routine care, just like in human medicine, you go to the doctor for routine care for a reason, to catch disease early and to be able to come up with treatment plans earlier rather than when the disease has reached end stage. I think that it's not my fault that the cost of care, especially at the AMC, which is really one of the best animal hospitals in the world, costs thousands and thousands of dollars for your animal that has a very, very complicated disease that, perhaps could have been and should have been caught much earlier if you would have just taken your animal to the vet routinely.
Do you ever use technology to work on a pet that isn't in New York City? I've seen surgery with remote robots on humans. Anything going on like that with veterinary medicine yet?
Not here yet, but we do a lot of laparoscopic surgery, and we also have an interventional radiology department here that does very, very advanced care for animals, very specific surgeries that could not be replicated elsewhere. But as far as robotic surgeries here, as far as I know, we're not there yet. But if it is coming, I'm sure we will have it soon.
Oh, nice. Does AI have an impact on your job at all, Dr. Carly?
Yeah, that's a great question. And, I think it's affecting every industry in the world. I think for us right now, how it's going to change my day-to-day is that it's going to make medical records much easier. I think just like all doctors, we spend a lot of time doing records and writing and sitting and recording things, especially for legal reasons, and also because other doctors will be reading my notes and making decisions based off of that. So what's actually sort of great is that there has been a bunch of AI programs for medical records that are being integrated into general practices, but also specialty practices in veterinary medicine that will allow me just to talk in a room and for the AI to sort of record what I'm saying exactly and put it into the medical record in a way that is very well written and very clear. It also helps write discharges for owners. For me, through the ER, all of our patients go home with discharges. So that's also something that's going to be extremely helpful. I spend a lot of time doing that. All of the doctors here do. So to make that part of our job a little bit easier, I think is actually like a huge benefit for doctors in general, and also recording conversations I have with people. So writing those comms up as I'm speaking and putting them into the medical record, it's actually great. And I think as far as like actual treatments for animals, there's nothing that we use in the hospital currently, but I wonder if that's something that's going to be available eventually. But I also think people can, just general people at home who bring their animals in, probably have access to like ChatGPT and can sort of Google their animal symptoms and probably have a fairly good idea of what they're going to be looking at.
I want to ask you about that because I've noticed, not with vets, but with human doctors, that they don't like that. When you go in and you say, I think I have this, that, the other, I read it online, or my sister tried this medicine and can I try it too? They don't like that at all. But you're saying you don't mind when the person comes in and says, I Googled these symptoms and it seems like my dog has Addison?
It depends. It depends on how that person uses that information and how they bring it up to me. That all depends on people's, I think, attitude and expectations. Because I think, you can get a lot of information that way, but also it's obviously not that it's a computer and they're not looking at your pet. And I think that's a huge part of medicine is actually, just physical exam and diagnostic findings that we do in hospital that you can't replicate online with just putting a paragraph in about your animal. But I do, I like, that means someone's invested in their pet and like wants to, come in with some sort of information. I think that's just human nature, to be honest with you. And I think it's, people trying to be responsible pet owners is trying to find out information beforehand and being prepared. Just like I think most people do that before they go to the doctor for themselves. So it's, to me, it's like an expected part of consultation when an animal comes in. For me, I expect that someone tried to probably look this up on their own. I typically don't mind as long as they believe that the things I'm recommending are in the best interest of their pets and I know better than the internet does.
Yeah, okay.
But I typically of course you're going to probably try to look this up,
Well, it points out something. When you look up your own symptoms, oh, okay, I have an upset stomach, I have a headache, my finger has a rash, whatever. But when you're looking at your cat, in particularly, they hide stuff. So what you type in, oh, he's not eating. Well, yeah, but you might not have noticed a big gouge under his belly that he won't let you touch, or, the ears that he won't let you go near that are just full of something they shouldn't be full of, So I think, the vet exam is really important with cats, maybe more so than dogs, because dogs tend to show you what's wrong, I find. What do you think about that?
I think that's true. And I think people are just more attuned to their dogs because most dogs are more social than most cats. So people interact with their dogs more. They also take them on walks outside and are much more familiar with their bathroom habits and also their eating habits because dogs tend to eat immediately when you feed them, whereas cats sometimes graze. So I think there's just a difference in behavior between the two species for a lot of them than I think just don't have as much information on their cats, even if they live with them all the time. So it's just a species difference. But then I also find that a lot of people are super in tune to their cat, especially in New York, because they all live in small apartments. Whereas in homes, I think it's a little bit different, but it very much depends on the owner. And also sometimes people have many, many cats and they can't tell a lot of things because there's so many of them in the home, or it very much depends. But I see everyone, all different walks of life, all different relationships with their animals. So I try to get as much as I can, but a lot of the times, in addition to the history, really my exam and the diagnostics that I'm going to do are really going to help the most.
Well, today we've been talking to Dr. Carly Fox, and I know I'm going to have her back because I've booked her already on the show. So stay tuned for that. I've even got my questions ready because they came in from some of my listeners. All right, everybody, we've been talking to Dr. Fox from the Schwarzman Animal Medical Center. And for me, an Animal Party and Pet Life Radio, be good to your animals. Ciao, meow. Thank you, Dr. Fox.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.